Over there, I could see inside them. Every child I had ever treated, every small body that had sat on the crinkled paper of my exam table, every infant held out to me by a nervous first-time parent. I could see them completely. Not their charts, not their height and weight plotted on a growth curve, not the fever that brought them in on a Tuesday afternoon. I could see the entirety of them, from the inside out, in a way that no medical instrument, no imaging technology, no laboratory panel had ever allowed. I could see everything that was in them, everything that was being held in their small, trusting, completely undefended bodies. And when I understood what I was seeing, when the fullness of it arrived, I wept in a way I have never wept in this body. Not from fear, from the weight of knowing that the parents of those children had never been told. That is what he showed me, and that is the only reason I am here. My name is Dr. Claire Donovan. I practiced pediatric medicine for 19 years in a mid-sized clinical practice in the southeastern United States. I was trained at 2 well-regarded institutions. I followed protocols. I trusted the evidence base. I believed, genuinely, without reservation, that I was doing everything right for every child in my care. If you are new to this channel, please subscribe. What I am about to share is the kind of testimony that does not fit neatly into any existing category, and there are more of these stories than most people know. Subscribe so you don't miss them. And I want to ask you something before we go any further. If you have a child in your life, a son, a daughter, a grandchild, a niece or nephew, someone young whose health you think about and worry about, drop their name or their initials in the comments right now. Just that. You don't have to say anything else. I'll explain why that matters by the time we get to the end. Let me take you back to where this began. I was 47 years old. I was in the middle of what anyone looking from the outside would have called the most stable, productive phase of my career. My practice was full. My patient outcomes were strong by every measurable standard. I had 2 nurses who had worked with me for over a decade. I had parents who drove 40 minutes to bring their children to my office specifically because of a referral from a parent who had driven 40 minutes before them. I was, by every external indicator, a doctor at the peak of her usefulness, and I had been ignoring a headache for 6 weeks. I want to stop there because I know exactly what that sounds like coming from a physician. I know. I have told parents in my office to trust what their bodies are telling them more times than I can count. I have sat across from exhausted mothers and said, "You know your child better than I do, and if something feels wrong, it probably is." And then I went home and took ibuprofen and attributed my own symptom to screen time and stress and the particular kind of fatigue that accumulates when you have spent 20 years at high vigilance inside other people's suffering. The headache became pressure. The pressure became episodes of what I kept telling myself was positional dizziness. The dizziness became, on a Thursday morning in late October, a moment of complete stillness in the center of my kitchen, coffee in my hand, briefcase by the door, in which I understood, with the clear and terrible certainty that only arrives too late, that something was very wrong. I do not remember the floor. I remember the ceiling of my kitchen. I remember the paramedics, but only in fragments, the way you remember a dream while it is still dissolving. I remember the sound of a monitor, and then I remember nothing for what I was later told was 11 minutes. 11 minutes of clinical death, resulting from a hemorrhagic event that the neurosurgeon described as rare, survivable only in approximately 1 case in 40, and profoundly unlikely to leave its survivor with full neurological function. I have full neurological function. I am standing in it right now. And in those 11 minutes, I was somewhere else. I want to be careful here, because I have read many near-death accounts. I have read them since coming back, in the way someone reads the accounts of travelers who have visited a country they've been to, looking for the parts that match their own memory and the parts that diverge. And there is a pattern in these accounts. The tunnel appears in many of them. The light appears in nearly all of them. The peace, that word, that inadequate and overused word, peace. It appears consistently enough that it has almost become a cliché. My experience had all of those things. I will tell you that plainly, because the matching parts are important. The light was real. The peace was real. the absence of the body, the extraordinary relief of not being in a body for 11 minutes, was real in a way I could not have invented and could not have fabricated from prior reading. Those elements of the accounts I had read were accurate. They were not metaphor. They were not the brain generating comfort imagery in the face of trauma. They were what they were described as being, and now I know that from the inside. But here is where my experience diverged. The prophetic accounts, the ones in which the narrator is shown the future of a nation, or the names of cities to flee, or the timing of an event still to come, that was not my experience. What I was shown was not a prophecy. It was not a vision of world events or political outcomes. What I was shown was something smaller and more specific, and in the way that specific things so often are, far more devastating than the panoramic. He showed me children. I was in the presence. I will not qualify this. I will not soften it. I will say it as plainly as I have ever said anything in my life. I was in the presence of Jesus. Not in the way religious experience is sometimes described as a feeling of connection or a sense of warmth or a theological conviction. I mean His presence, specific, personal, completely unlike anything in this world, and completely recognizable in the way that things which are exactly what they are cannot be mistaken for anything else. And He did not show me the end of the world. He showed me the inside of children. Specifically, He showed me what is in them that was put there. I need to stop right here and address something directly. I have lived with this testimony for 2 years now. I have shared it in small groups and in larger settings. I know exactly what some of you are thinking as you watch this, because I have heard every version of it. You think I am about to deliver an anti-vaccine manifesto. You think I am about to tell you that medicine is poison, and that doctors are liars, and that you should throw out every prescription and every protocol and every piece of guidance your child's physician has ever given you. I am not going to tell you that, because that is not what I was shown. What I was shown was something more precise and more quietly urgent than a blanket condemnation of anything. He showed me the accumulation. That is the word that arrived, accumulation, and it has not left me since. Not one thing, not a single agent or ingredient or intervention singled out and damned. The accumulation, the sum total of what is being put into the bodies of children across this country and others, through multiple vectors, across multiple systems, in quantities and combinations that no individual system is tracking, and no individual parent has been handed the full picture of. Not because anyone is necessarily lying, because the full picture has never been assembled for them to see. Let me tell you what I did not know before I died. In 19 years of pediatric practice, I administered or ordered what I would estimate conservatively to be hundreds of thousands of individual interventions into children's bodies. Vaccines, antibiotics, supplemental formulas, allergy medications, medications for attention, for anxiety, for sleep, for stomach acid. I followed the schedule. I followed the guidelines. I had the conversations with parents that the guidelines told me to have, in the language the guidelines suggested, with the reassurances the guidelines prepared me to give. I did not know what was in some of those preparations beyond the active ingredient. Not fully. Not in the way I knew, say, the mechanism of action of amoxicillin. Excipients, adjuvants, preservatives, stabilizing agents. Things that are there not because they heal, but because they make the healing agent deliverable, stable, manufacturable at scale. Things that are not discussed in the consent conversation because they are considered not to require discussion, because the individual doses are within established limits, because the studies that established those limits looked at the things in isolation, not in accumulation. He showed me a child. I will not describe this child in any detail that might identify anyone. I will tell you that he showed me a specific child, in a way that made clear this was not an abstraction, but a particular, beloved, completely known person. The kind of seeing that I described at the beginning, the inside-out seeing, the total seeing. And he showed me what was in that child's body. Not as a diagnosis, not as a chart, as a weight, as a burden that the child's small systems were carrying without anyone having calculated the total. And then he showed me the gap. There is a gap. This is what I understood. This is what he was showing me, with a specificity and a tenderness that I do not have adequate language for. A gap between what parents are told and what parents would want to know. This gap is not always created by malice. It is created by system design, by the scale at which medicine operates, by the fact that the conversation we are trained to have with parents is not the conversation that would fully inform them, but the conversation that fits within the time and the scope and the legal framework of a standard well-child visit. Parents are told, this is safe, this is recommended, the benefits outweigh the risks, sign here. Parents are not told, here is everything that is in this, including the parts that are not the active ingredient. Here is what we know about how those parts interact with the other things your child has already received, and the food she eats, and the water in your municipality, and the ambient chemical exposure in your specific neighborhood. Here is the full picture. Here is the accumulation. That conversation does not happen. Not because your child's doctor is cruel or corrupt. Because that doctor was trained, as I was trained, to deliver the conversation that fits the system. And the system was not designed around the full picture. The system was designed around the active ingredient. I came back from 11 minutes of death, carrying the knowledge that the gap is real. Not a gap between truth and conspiracy. A gap between what is known in fragments by different actors and different systems, and what any single parent of any single child has ever been given the chance to hold in their hands and understand as a whole. The return was not peaceful. I want to be honest about this because the peaceful return stories are not the only kind. I came back with urgency. I came back with a weight that I did not know how to carry for the first several months. I was a pediatrician. I had a practice full of children and parents. I had colleagues I respected. I had a professional identity built over 19 years on the premise that what I was doing was enough. It was not enough. And I knew it now from a vantage point that made denial impossible. This is where the foundation changed, because the knowledge could have broken me. There is a version of this story in which I come back, feel the weight of what I was shown, feel the impossibility of changing a system I am one small part of, and collapse into it. I have watched that happen to other people who've had experiences like mine. The return without the anchor is just re-entry trauma. The knowing without the grounding becomes paralysis. What he gave me, the part I have not yet fully described, was not only the vision of the accumulation. He gave me the conversation to have instead. He showed me what the parents of the children I treat actually need. Not a different pamphlet, not a different set of statistics, a different kind of presence on the other side of the exam table. A presence that says, I see your child as the specific, irreplaceable, non-standardized person they are. I am going to bring you into every decision. I am going to tell you not only what I recommend, but what is in what I recommend and why. I am going to give you the time to ask the questions you were afraid to ask because you did not want to seem difficult or uninformed. I rebuilt my practice around that conversation. It is slower. It requires more time per visit than the current reimbursement structure easily accommodates. I have had to make adjustments to how the practice runs in order to protect it. Several parents have left because they wanted the fast version, and I was no longer offering it. More parents have arrived, found me through word of mouth, through recommendations from other parents who had sat in the exam room and experienced something they had not expected, who wanted the other thing. Those parents tell me things in the appointment that parents typically do not tell doctors in appointments. They tell me what their child eats in a typical week, in real detail, not the aspirational version. They tell me about the environmental exposures in their specific neighborhood, the plant 2 miles away, the creek that runs along the back of the property, the pesticide schedule of the local park where their child plays 3 afternoons a week. They bring me the list of every supplement and every over-the-counter medication and every prescription their child has received from every provider, and we look at it together. I look at accumulation now. That is what changed. That is the root that deepened. And the trunk thickened because I began to understand that the conversation I was having with individual families was the same conversation that needed to happen at scale. I began writing. I began speaking at local events. I connected with other physicians who had come to similar places from different directions. Not NDEs, not mystical experience, but clinical observation and growing unease, and the same question I was now carrying. Who is tracking the full picture for any individual child? The answer, in most cases, is no one. No single physician or system has the full picture. The gap does not exist because of malice. It exists because of fragmentation. Because the allergist does not see the neurologist's notes. Because the school nurse does not see the pediatrician's file. Because the pediatrician, I am talking about myself, sees the child 4 times a year for 20 minutes and does not ask the questions that would surface what the parent has been quietly, anxiously holding. The branches spread. I am not going to name specific programs or platforms or organizations because this is not an advertisement. I will tell you that the conversations I started having after my return have multiplied in ways I did not engineer and could not have predicted. Parents find this testimony. They share it. Other parents with similar experiences, not NDEs, but the experience of being a parent who noticed something, asked the question, was dismissed, kept noticing, kept asking, they write to me. The accumulation I was shown is being noticed from many angles by many people who have never heard of near-death experience, but have lived in the gap between what they were told and what they were watching happen. And the fruit. I want to tell you about a father. He came to me after a presentation I gave at a community health event. He waited until everyone else had spoken to me, and then he stood there for a moment before he said anything. He had a son, 7 years old, healthy by every standard measurement, height, weight, development, cognition. But the father had been noticing, over the previous 2 years, something he could not name. A quality of tiredness that did not correspond to sleep. A kind of low-grade fog that would come and go without apparent cause. He had brought it up at 2 well-child visits. Both times he was told his son was thriving. He was told the numbers were excellent. He wanted to know if I thought the numbers were the whole picture. I sat with him for 45 minutes. I asked him to walk me through everything his son had received in the last 3 years. Every medication, every supplement, every significant dietary change, every environmental exposure he was aware of. We made a list. It was a long list. Nothing on the list was unusual for a healthy American 7-year-old. Everything on the list fell well within established individual safety parameters. We were looking at accumulation. I cannot tell you what I told that father to do. I am not his son's physician. I am not your child's physician. I am a woman who died and came back with a specific knowing, and I am telling you what that knowing is, and what you do with it is your decision made in conversation with the people who know your child and know medicine and are willing to hold the full picture with you. What I can tell you is that the father left differently than he arrived. He left with the vocabulary to have a different conversation with his son's doctor. He left with the questions he had not known to ask. He left with the knowledge that what he had been noticing was not paranoia and was not overprotection and was not the anxious catastrophizing of an uninformed parent. It was attention. It was love taking the form of attention. And attention is what children need someone in the medical system to take seriously. That is the fruit. Now I want to say something that I have been sitting with since I came back, and I have not always known how to say it. I know what this testimony costs. I know that when a pediatrician stands up and says, "Jesus showed me something about what is in children's bodies," a significant portion of the people listening will categorize me immediately. Anti-vax, conspiracy theorist, Doctor who had a traumatic brain event and lost her critical faculties. I have heard every version. I have had colleagues who heard versions of this and chose not to speak to me anymore. I have had a medical board inquiry that was ultimately resolved in my favor, but was not a pleasant experience. I have had family members who love me look at me with a concern that had nothing to do with my health. I anticipated every one of those responses before they happened. Not because I am prescient, because they are the logical responses of people whose framework cannot yet accommodate what I am describing. I understand that framework. I built my entire professional life on it. When I heard, before my own experience, someone claimed to have received spiritual insight that challenged medical consensus, I would have had the same response. I know exactly what the version of me that had not yet died would have done with this testimony. I am asking you not to be that version. I am not asking you to abandon medicine. I am not asking you to dismiss your child's doctor, or refuse treatment or throw away the schedule. I am asking you to do one thing. Become the parent who asks for the full picture, not the summary, not the approved language on the informational sheet. The full picture, in a conversation where your questions are welcome and your attention is treated as the asset it is, rather than the inconvenience it too often becomes. That is the conversation that changes things. Not a revolution, not a system overhaul, a conversation, one family at a time. That is what he showed me was possible. That is what I came back to say. I have sat with this testimony for 2 years. Some days the weight of it is enormous, and some days the weight of it is exactly the right size for what I have been given the strength to carry. I am not a prophet. I am not a crusader. I am a pediatrician who died for 11 minutes and came back knowing something she did not know before, and who has been trying in every way available to her to close the gap. If you are a parent watching this and something in what I said landed in the place where you have been quietly worrying, sit with it. Do not move past it quickly. The quick move past the quiet worry is how the accumulation continues without being examined. Sit with it. Ask the question. Find a physician who welcomes the question. They exist. If you do not have access to one, know that access to that conversation is something that should be demanded and not simply hoped for. If you are in medicine and something in what I said resonated, not because of the NDE, but because of what you have been noticing in your own practice, in your own patients, in the quiet accumulation of observations you have not had the framework to bring forward, I want you to know that you are not alone. The unease is not a malfunction. It is attention. It is love taking the form of attention. There is nothing else I want to say that would be more honest than sitting quietly with what was just shared. I am still a doctor. I go to the office. I see the children. I follow what the evidence requires me to follow, and I hold what the evidence cannot yet contain, and I live in the space between those two things, which is a harder place to live than either of the sides would be. But it is the honest place. It is the place he put me when he sent me back, and it is the place from which I say, subscribe if you haven't, because there are more of these stories, and they are all pointing toward something. Come back, bring the question with you, and please, put that name in the comments, the child you thought of. I will hold it.